I always thought hair, skin, nail is a reflection of our inner health. So I always wanted to show that if we improve our inner health, can we improve our scalp? Yeah. So that was my thought about it, and I've been working on this for last 7+ years, and I'm going back to basics. So this is what I felt, and these are the things which I'm interested in. So I'm giving my PRP as the Ultra PRP, and I've added Ultra PRP Plus as another one, where I'm in combination with minoxidil, finasteride, vitamin B12. I have forgot to add vitamin D, which is very important there, and hormonal and lifestyle and dietary changes. So I don't have any control on the genetics, so I am one of the examples here. But definitely I can make change with a lot of other things like diet, stress, chemical, lifestyle, hard water, and hormones. So I have a series of around 594 patients, and I have a range of patients from 18. I've seen a lot of youngsters coming nowadays with hair loss, and I do get their blood samples done, and I check for their all vitamins, hormones, and all the other parameters. Wherever I can do help, I will change those things. And so I do get their blood samples done, and then I check for their vitamin status. I have seen a lot of my patients with vitamin D3 deficiencies and vitamin B12 deficiencies. And triglycerides is one which I have understood that triglycerides is one of the component which we have to understand, because it adds a lot of inflammation to the perifollicular area. So I start doing their hair assessments with the first consultation, and I understand their what is the hair, and I do get check their diameter and the density, and I'll take photographs and all both the densitometer, and as well as I make some markings over the scalps. So these are going to be my work of area where I'm going to check them every sessions when they come. And it helps me in showing them also that it is going to make a difference, but not if not early, it will take some time, but it may do some changes. So in this you can check it out. I have male patients the range from 1 to 7. I've categorized them, and I've seen a lot of my patients from NW1 to 4, and females I have got more in the grade 1 to 2. So I keep advising them that it's going to make a difference, but it takes a lot of time. Of course, it's a time consuming. It takes nearly 6 to 9 months for me to show them the result. So why this multimodal therapy? I'm sure everybody is aware of this, but definitely it makes changes, but I have done a cyclical changes in this. I have added, so multi-spin PRPs is one of my favorites. And the minoxidil, finasteride, balanced diet, I do change the diet. De-stressing, I advise them to do that. Lifestyle modifications, I have a series on that. Wash with soft water and mild shampoo to keep the scalp clean and healthy. Correction of deficient supplements and hormonal corrections if needed. So likewise, I tell them that these therapies have a different way of approach. So it cannot be categorized with a lot of chemicals, but yes, dechemicalizing is very important. And improving the inner health has made a lot of difference in a lot of my patients. And these are all real pictures with their, you can check it out. I do 8 sessions of these therapies, and first 4 sessions, they're going to make a little difference. And when at the end of 8 sessions, it has shown a lot of significant changes. So I advise them to maintain their balanced diet, vitamins and minerals, stay hydrated to support the overall health. Stress management is very important, regular exercises and relaxation techniques, and regular blood tests. Because I see over a period of time, if the blood tests, if they are not done, the vitamins do go down, the micronutrients do go down. So we have to keep them at the upper limits of the normal, and it makes a lot of changes. The initial consultations, I always do the measurements of their diameter and the densitometer with the hair diameter and the hair densities are checked. And you can check it out. The first sessions, when they come, they will be like 72. If you can check out the yellow cubes. And after 4 sessions, the diameter increases, and the 8 sessions, you can see the diameters have done really well. Likewise, for the hair density also, you can check it out. The columns 8 will be having the more density. So I have seen a lot of changes in patients from grade 1 to 4. But as we go further, I see the density is going to be not okay. The follicles, whatever are there, they would grow, but definitely they not make any much of a difference. But yes, they will have other solutions like surgical solutions. And for females also, you can check it out. The grade 1 and 2 have definitely done a lot of improvement in their outcome. And other non-surgical, non-cicatricial ones, you can check it out. They have done extremely well. So I recommend normally, patients to have for grade 1 to 4, they should try non-surgical, because native hair, as doctor was mentioning previous, that native hair do have a scope to improve back. And if they improve, then it's going to add for better understanding for whatever is needed, then we can do grafting. But other from grade 5 to 7, I would say that it may or may not improve, but definitely surgical will be the answer for them. Likewise, for female grade 1 to 2, always try non-surgical. So to conclude, I would say always ask for get the blood test done, work on your labs, and then get in check for the vitamin D, vitamin B12, iron, and triglyceride levels. So triglycerides mainly it can be controlled with the diet, or you'll have to add on some medications. But I always recommend non-surgical treatments for their first initial hair loss, hair fall therapies, and then try for the surgical ones, which will definitely give a different, and combination of both surgical and non-surgical, they do pretty well. So patients with if they are NW 5 to 7, I always advise them for surgical first, and then I advise them for non-surgical, because the native and the donor area both are going to do very well with the post hair transplant therapy. And for lifestyle changes, of course, I've already mentioned that they have to de-stress themselves, regular exercise, eat well, sleep well, reduce screen time as much as possible. That's it. Thank you. This is I think the largest human congregation is happening in India at present, and it's going to be there till February 26th. And there are